My name is Cory Ulrich. I'm Product Manager for Stotz Medical, and today we want to introduce you, together with our partner from the US, Focus It, to the MP100 Web. With pioneering technologies, Stotz Medical is setting new standards in veterinary medicine. With the MP100, you can treat indications like insertional desmopathies, all tendinopathies, arthrosis, bone split, and all trigger points. The MP100 is very effective. The treatment is long-lasting, economic, and easy to handle. It's a mobile unit with radial shockwaves, what means the shockwaves are generated with air pressure.
My name is Chris Lauer. I'm a physiotherapist for 40 years. I'm working the last 15 years primarily with horses. And with the MP100, I'm working now for 2 years, and I have a lot of success. I use this unit primarily with sports horses, dressage, show jumpers, and eventers, in acute care and also in preventing minor problems to occur and give a lot of problems afterwards. I only can say this is a great thing to work with. I have a lot of success. It helps me tremendous, and I'm very glad to have it in my clinic. Thank you very much.
This is the MP100. The MP100 is a radial shockwave unit with an integrated air compressor, and the shockwaves are generated with air pressure. It sounds like this. It's a little loud, but normally the horse is okay with the sound. And you start beside the horse, you start the machine beside the horse. You wait until the horse gets used to it, and after you start to treat. Crystal, here are two parameters, energy and frequency. What is your favorite pressure with bar, with the energy? Where do you start?
Depending on which muscle I treat, I start with about 1.8 bar and going up till the horse reacts strongly.
Yeah.
But I still need the horse to be able to relax. If I go too far with the bar, the horse starts to close his muscles, tightens up, and then is not able to loosen it again. So
start low,
yeah,
and higher slowly,
yeah,
adapting to the horse.
Yeah.
And what about the frequency? With what frequency are you working?
If I have a horse with very, very severe problems, muscle problems for example, I start with a lower frequency, around 8. Sometimes I also have to go down till 5. But my favorite is about between 10 and 12. That's quite good.
And what about the shocks? How many shocks do you use normally for a treatment?
Depending on the area. So if I have an area about this size, it might be 2,000 shots for this area. If I have a gluteal muscle, that's about 3,000. If I have to do the whole back, then also about 4,000. That means 4,000 on the right side, 4,000 on the left side.
So it's 8,000. Okay. And for the different therapeutical depths, depending where you are working, you have different transmitters. They are made of different materials, and with different transmitters you can reach depths from 2 to 6 centimeters. Okay, the next points are the costs. What about the costs? Here is one part inside where you have to change. How often do you change the little piece inside?
Depending on how many times I use it,
yeah.
But normally every 3 to 6 months.
Okay, so the costs are okay?
Yeah, that's fine.
Yeah, it's economic, so the mobile unit MP100 is very economic. And the therapy, what about the success? Is this a really good support for your therapy? A very good combination, or?
It's a great support of my therapy, because when I go in with my fingers, I can really tell where the most problems are, and then I can use the MP100 and to really focus on that area.
So it's very long-lasting.
It's a long-lasting therapy, and when I have a horse with acute problems, I do it 3 times in a row, every week once. And if I have just like normal sports horses with no big pain, I do it once a month.
And what would you say for the horse? Do you think the horse are enjoying the therapy, or are they scared?
Actually, they learn to enjoy the therapy. Few horses are really scared in the beginning because of the sound. But then you are in a stable like here, and the horses around are so calm. Even the horses you are treating, if they have never ever been treated before, it's fine.
So you don't need any
sedation, no.
That sounds great.
Yeah,
so you would say
it's a real great unit, and for me as a therapist, it's really helpful. And I even have customers who have their own unit at home.
In their stables?
In their stables.
So you give introductions and they treat by their own?
Yeah.
And you are very often all over Europe, you are working, you always have the MP100 with you in the car?
In the car, yes, not in the airplane.
Not in the plane, but in the car?
Yeah.
Okay, so many thanks to you, Crystal.
You're welcome.